Coming up today on Houston Life, we're at UTMB Health in Galveston chatting with Dr. Carlos Dostal about how you can live a healthy 2024. Make sure you're watching. Today on Houston Life, we are taking a look at your health for 2024. Dr. Carlos Dostal from UTMB Health is here to share some tips for the year, and a big one is the importance of having a primary care provider. Of course, you work as a primary care provider, so you know firsthand this is a really important thing. Why is it so valuable?
Well, we know just from studies across the world and in the United States that that regions that have more primary care providers have an overall population with better health. Okay. Unfortunately, we also know that about 100 million Americans do not have a primary care provider, so that's about 1/3 of the population.
That's big. I mean, I say that I actually don't have a primary care provider, so I'm interested to know more. Why is it so important? As
a primary care provider, right, I have a more intimate relationship with my patients than you may have with a physician when you walk into a specialist office or a urgent care setting. And the reason is because we take time to really get to know our patients. When you establish with a primary care here with me at UTMB, we take an hour visit to really get to know each other, and that means learning all about all of your past medical history, every medication that you may or may not take, and all your prior surgeries, your family history, your social history, and you know, that includes what are your habits, what's your diet like, what sort of things are going on with you at home, what are your stressors, what are your triggers, all of that.
It's almost like your primary care provider can be almost like a life coach for you.
Absolutely, yes.
So let's say we're starting from a pretty good baseline of health. What tips would you give us moving forward into 2024 that can help us stay healthy and live a healthy year?
Diet and exercise are number one, right? So there are multiple diets, and you should discuss these with your primary care physician. For instance, if you have high blood pressure or hypertension, you may benefit from the DASH diet, which is a specialized low sodium diet. Other options may be like the Mediterranean diet, which is, you know, high in whole grains and omega-3s, and also has a significant social component of, you know, eating with family and friends, and incredible health benefits as well. There are other diets that you've heard of on TV, fad diets and other things, but you should really discuss those with your doctor. As far as exercise, the American Heart Association recommends that we have at least 150 minutes of moderate intensity exercise a week. That is basically individualized. So for me, that might mean burpees.
Okay, I'm not doing burpees.
For some of my other patients.
That's moderate for you.
You know, but that's why you have to take a patient-centered approach, because, you know, for some patients of mine, that might mean just a brisk walk, and that's enough to get your heart rate going, to get that, to get your engine running, right, and to get a little bit of beads of sweat, and 150 minutes a week translates into 30 minutes 5 days a week, which isn't too bad. You can also substitute that with 75 minutes a week of high intensity exercise.
Should we maybe start with the moderate intensity before we move up to the high intensity?
And so again, that's something that is individualized and a good conversation to have with your primary care physician.
Do you have any tips for getting started on that 30 minutes a day? Because you say it doesn't sound like a lot, but if you've been doing no exercise, it's
So you know, one thing I like to tell my patients is to set your wristwatch or phone alarm for 15 minutes, and then just take off walking out your front door. Walk for 15 minutes, and then your alarm goes off, and you turn around and you head right back home, and you're done. You've got your 30-minute walk in, and you're going to be healthier in the year for it.
I love that. And then anything else that we can do?
Yeah, age-appropriate cancer screening and immunizations, and making sure that you've discussed those and that you're up to date on all of those, so that you've had, like, you know, for instance, your mammogram or cervical cancer screenings, your PSA or colon cancer. And, you know, for our smokers, we also, many insurance companies have benefits for low-dose CT scanning for early detection of lung cancer.
Which, of course, all of this is something that if you have a primary care provider, they can advise you on this and they can let you know what's available to you.
Absolutely, and that's why people with primary healthcare providers are 19 to 20% less likely to suffer early death.
I like that statistic. Dr. Dostal, thank you so much for chatting with us today. Now, of course, if you need a primary care provider, you can just scan the QR code that's up on your screen now, open your smartphone, scan it. That'll take you through to UTMB's list of primary care providers who are available. You can even see Dr. Dostal as well. And this is if you have insurance, and if you don't have insurance, you have options for people as well at UTMB.
That's right. In Galveston County, we have the St. Vincent's Clinic, which is staffed by UTMB faculty, including myself.
Fantastic. If you need to find out more, then jump online to utmbhealth.com. Thank you, Dr. Dostal.
Thank you.
Again, you can scan the QR code on the screen or go to utmbhealth.com to find a primary care physician. You can also call 800-917-8906.
Yeah, if you've been putting it off, it's a great time of year to do that.